We have to select a mouth prop at first and then do it. Now we'll retract the tongue and other portions, and now we'll use a suction to suck the oropharynx, I mean the juices inside. This guy has broken his jaw in a street fight. So these forces we should remove. Now we will use our fingers to push the moisture packing so that it doesn't get damaged. And I will swipe to select surgical instruments, and I will wipe the surfaces of the teeth with these gauze and cottons, and we'll sanitize the remaining part with the chlorhexidine solution. This is the Younker's option. Now I will remove the sweetheart retractor, and we are just prepping the patient now. These are two medium sized toe retractors, and we will retract the upper lip bilaterally, and we will count the maximolar and orthodontic lungs. Now it's time for giving local anesthesia, and we will apply this on the every teeth, I mean above of the teeth. And I will swipe to select a Colorado tip electrocautery. Now we will use this electrocautery pen to cut through the mucous membrane by this way. Now I will swipe to select a mold peristocial elevator, and this elevator we will use to retract the mucous membrane up to the nose portion. Yes, this electrocautery plane is to remove any bleeding or sealing inside it. Now we'll use a curved freer instrument to gently sweep along the PD4M rims through the downward angulation. We just have to remove the nose portion from there, because we are mending the jaw, not the nose. So this would make it secure. Thanks Marwa Safa. Now I'll select a toe out retractor again. We should use another bayonet forceps there. Just have to go through there, these sharp tips. We should do a small fissure, and now the drilling portion begins. Now I'll repeat these steps to the side. This is another curved freer. Now we have to cut through the jaw by this saw. Of course we need a saw, electric saw there. We are cutting through the jaw right now. This process is called osteotomy. It's for enhancement and upliftment of the jaw. I mean upper jaw, of course. Now we'll remove the double guarded osteotome. Now this is actually the osteotome that we are doing, nailing the jaw. Have to be careful here. Now we'll select a mallet, and then using the mallet we'll gently tap the small white surface and we'll repeat the step to the collateral side. After checking the patient's blood pressure and everything, we will apply. Now we will just crack open the jaw. Right now the jaw is open. Have to remove the nose out of the way. Now we'll use our both hands to remove the maxilla. Now we'll use the rhongia to trim bony interference from the superior aspect of the maxilla. Now we have to sieve it with the sutures. Now we'll use bulb irrigation to thoroughly rinse and remove any bony debris or remaining tissue of the maxillary sinus lining. Now we'll place the surgical splint into the down lips, below lips, lower lips, lower teeth. Sorry, my mistake. We had made a wire loop. Now we'll place the wire loop to engage at least 2 upper and 2 lower orthodontic lugs, and use the wire to start to apply firm mandibular fixation between the maxillary and mandibular arches. High Wharton dosed. It's time for a second wire loop and a third one to cover all the teeth. Now we will repeat this process on all the parts and then fix the jaw. Now this is the most important one. We should check the dental midlines and the relationship with the facial midline. Midline should be consistent with the surgical treatment plan. This is actually accurate. Just screwing through the portions. Over time, I hope that those screws and those nails would dissolve and the bone would heal on its own. The occlusion has been removed, and we will now gently open the patient's jaw and ensure the mandibular teeth passively. Now we will use the bulb irrigation to thoroughly irrigate the maxillary vestibular wound with normal saline. We will now remove all the retractors right now. Using a toothed forceps right now here. Have to be careful. This is time for the suturing. These are the non-dissolvable sutures. So the patient has to come later. To cut the sutures. Ask any doctor you can find. Now repeat the closure. You can okay, that's fine. Now this tube is to empty the stomach and everything. Now we'll select the scissors there and use the scissors to cut through it. almost ended. Okay guys, our operation is ended. Now we'll be going. Goodbye and everything till then.